Hello everybody, welcome back to my channel. How's everybody doing today? Well, I hope you're doing okay. Today I want to resume some of the topics that we used to talk about, but we did not have a chance to continue to explore that subject. So today we are going to continue with our case management scenario, but in a different approach. Today I'm gonna explain and demonstrating some information and some other real life scenario, meaning that I'm gonna point out three different clients and I'm gonna explain the symptoms and I'm gonna explain the problem and I'm gonna tell you guys how I'm gonna resolve their issue. So those are the three clients that we will be talking about today. Before we get into that, I just want to give you guys the overview and the review of the case management. So what does case management mean in terms of our profession? So let's break down into those two words. So let's explain what the case means. So the case, we can say they are a transaction. They can be a part of service that you provide for the hour, and the case can be a project as well. So when we talk about case, we usually refer to the complex activity. Okay, so that's a key word. The case need to be complex, so they are a case. That's something that you're dealing with. And also the case has to be involved with multiple persons, inside, out of the organization. A definitely case will be involved with multiple documents as well. So that's something we talk about case. When you talk about case, then you need to talk about management. So why the profession is called case management? Because you are complying many different type of project into one single whole item. So definitely when you talk about management, you're talking about the information can be held for a long time and then will become an official record for people to check out. So that's will be considered as a case management. So when you put those two words together, we can say again, case will be very analytical, means that they have to compliance with business rule, they have to be involved in with collaboration, and sometimes the case had to be interact with a particular party. In this term we call client, but you can refer them as a customer. If you're doing sales, then you're dealing with customer, you're dealing with supplier. But for you talk about client, when we talk about our profession, then we refer those people as a client. So case management, again, make it simple, is involving with file, the collaboration between a provider within yourself and involved with the family member, involved with the upper management, involved with other health care provider, government official provider to get things done. And that is a brief introduction of a case management. And of course, you need to support your documentation, and then you have to compliance with the audit. So let's get into the three clients that I want to talk about. So the first client I want to talk about is a female, a lady in her mid-50s. So let's talk about what happened to this woman first. So woman is in her 50s. Is Arabic descent. She suffered from depressive symptoms. So from now on, when I say whatever the symptoms they are suffering from or whatever the symptoms they have, I will tell you guys they are in their baseline. Means that the baseline means what happened at that current moment, what they present to you, and how their behavior at that moment. So the lady has a depressive symptoms. She had issue with ADL. So what does ADL mean? Means that their independent way of dealing themselves, like how will they be able to clean themselves. So when we say ADL, we are referring clients' cleanliness. Means that are they a clean person? Are they able to maintain a hygiene? So the keyword is hygiene. That's ADL. Okay. So like I say again, client feel depressed, had a depressive symptoms, and then she suffered from multiple ADL issue. Means that their hygiene is really poor. The client does not take her medication. So the way to address this, when we talk about all those symptoms here, and then we have to refer to their current function. So the current function is what happened to them right now. So the client is older woman, Arabic descent, had a depressive symptoms, had a limited mobility, and his limited mobility issue exacerbating combined when his mental and physical symptoms are all together. So that's her main symptoms. And client does has an ADL issue, like I said before, and require a support from a caregiver to give her a bath. And client also need to continue support with the medication. So I mentioned before, client is not med compliance. So what is something that we can help with this client? We can prompt the client to manage her hygiene. We can utilize the caregiver support to help this woman to maintain her hygiene. And of course, we can use a lot of grounding technique. So the grounding technique means that client can find the places to be with herself, and then just trying to use those relaxation coping skill, and those are the grounding technique the client can use. But they need to utilize the case manager to help. And of course, the caregiver can support her with the medication. Like I said before, the client does not stay med compliances. But client also had fear because she had upcoming surgical procedure. So that's something that you need to concern about when you deal with a client, because she had a surgical procedure, and at that point, you kind of have to assist the client to develop those coping skills and make sure clients feel much ease before the surgical procedure. And of course, you can remind with client's appointment. So this is the first case. The second case is the other female. She is in her early 40s. So let's talk about her baseline first. So client have anxiety symptoms. So it means that client always constantly feel anxious. Client has a poor organizational skill. Client is not able to manage a lot of organizational skill. Means that her place is really messy. Needs someone to support that. And client had problem with mood stability. Means client always suffer from has a tendency of arguing with the staff, unable to maintain those mood stability. And when you talk about that, a lot of time when you say a client or a person had a poor regulation on the mood stability, you can refer them. They may have borderline disorder, but that's something that you need to consult a psychiatrist to find out. So obviously the client may suffer from borderline disorder. That's something that you have to make sure that you document on that. So let's review client's current function. So client have anxiety symptoms and always seeking for attention due to client has a borderline personality disorder. So borderline personality disorder can be a very severe mental health symptoms if not treated. Client may have a lot of suicidal ideations, such as cutting her or his waist, cutting her or his artery, or that's very common for the people who have a severe BPD, borderline personality disorder. They can cut themselves when they didn't get attention. So that's something that I personally will be paying more attention on. So this is one of the client's issue. And client is also disorganized, means that, like I mentioned before, client's place was really messy and require a lot of support, require a lot of staff support to maintain his space. She's not a hoarder, not to that point, but she need to find some way to organize her space, and this is when the cleaning crew or the case manager will be able to help that as well. Client also have problem following up with a physical therapist appointment due to client's limited mobility. The client always require people to remind her to go to the physical appointment because she doesn't like it, and then she definitely suffers some kind of anger issue. So let's jump into what we can do to help the client. So my approach is to give client a mindfulness technique or slowly redirect the client's thought process. And then I always encourage client to attend the DBT session to help her to reduce her anger and help her to treat with her borderline personality disorder, because DBT has a lot of beneficial way to help the client. And then I also suggest client to work with the IHSS worker, in-home support worker. They can help her to improve her organizational skill at home. And of course, constantly remind client to attend the PCP appointment. So let's get to the last client. This is a male client. The client is in his early 30s. Client is very disorganized as well. The client does have a poor ADL due to, again, limited ability to clean himself. And client have severe depressive symptoms. Those are the baseline. But when you talk about this client's current function, client does have a brain damage. So that is part of the reason that client is unable to perform certain function by himself. Client does have a stroke and a limited cognitive ability due to previous brain damage. So this is more like a neurological part of the symptoms for the client. Client probably does not need a lot of a case management service, but client may need to have a referral. So you as a clinical case manager can refer the client to a neurological department and to further ask this neurologist to examine client's brain function to see the damage of his brain and the stroke. How does that have a heavy impact on the client to perform on a daily task? And then due to client's brain damage, he also have a problem communicating with other person. And the client experiences, of course, depressive anxiety symptoms due to the brain damage. Client also suffer from poor self-image. Client has a very low self-esteem. So this male client always didn't feel that he's doing really well due to those issues, self-image and poor self-esteem. So let's jump in to see how we can help. So client will be utilize my help. Me as a clinical case manager, I will remind client all his appointment, all coming hospital, all coming socialization appointment that he need to attend. Especially, I need to work on a lot of coping skill to improve his self-image and self-esteem. And client has a problem to advocating for himself. So I have educating the client to working on different kind of coping skill to maintain his willingness to continue involved with the treatment. And we, as a case manager, will also help client to manage his hygiene. And I will provide different kind of organizational skill to support this client. And I also will encourage this client to make the list of what you want to do in the future to do this to help himself to become a better person. So those are the three type of people, three type of client that I used to work before. If you do have any question, concern about today's YouTube, you can always feel free to leave any comment and suggestion under my YouTube channel. And then I hope I will see you again next time. Well, I'll definitely see you again next time. Okay, bye bye. Thank you for checking my channel today.